So hi everyone, how are you all? And the best thing right now is that exam is over, and I'm here with Alan next, and to discuss the questions that have been there in the exams in the biochemistry section. And I heard that most of the questions were from vitamin. There was C of vitamins in the MCQs this time, right? I was able to recollect some questions from the students. Okay, so let's see the questions, what were they, and what is the probable answers, right? Okay, so in this session I need your help, right? That what if something is missing in the MCQ, something is something that can be added or something that can be deleted, right? So if any option you want to add or you want to correct me, then you're most welcome. Please comment on that, right? But right now what is the best thing is that exams are over, and that is the most relieving thing. नहीं, बिल्कुल अब थोड़ा शांति वाला माहौल होगा कुछ दिनों के लिए, right? And I hope and I believe that all of you will get all your desired ranks and desired branches, maybe anywhere in India or maybe in your favorite city, right? है ना? तो बहुत मेहनत कर ली यार, अब थोड़ा सा टाइम है कि अपने आप को पैम्पर किया जाए, राइट? है ना? कि दिल जला के दी है हमने ज़माने को रोशनी, कि दिल जला के दी है हमने ज़माने को रोशनी, यूं ना समझना कि जुगनू पकड़ के हाथ में हम चल दिए हैं, राइट? है ना? तो वो आप सबके लिए, लाइक ऑल द स्टूडेंट्स दोज हु आर लिसनिंग टू मी राइट नाउ, है ना? Okay, so we believe in hard work. So let's start. Have the idea about questions, right? So there was a first question, that is history of raw egg white consumption. So guys, we all know raw egg white contains something that is called as avidin. Fine. And avidin prevents the absorption of biotin, right? We all know that. So there was an image was given, and that had redness and baldness, something like that. So probably this is the case of biotin deficiency, guys. Biotin deficiency is seen commonly in the cases where there is a raw egg white consumption, but that is in very large quantities, right? In the large quantities, not just 1 or 2 eggs. It may be like minimum amount of eggs per day mentioned in the literature is like almost 8 eggs per day. Clear? So that much high amount. And guys, biotin is very important for all the carboxylases. Fine. So it is very important for the carboxylases, and there are 3 carboxylases that we all know, that is rate limiting step of fatty acid synthesis, that is acetyl CoA carboxylase, then pyruvate carboxylase for the rate limiting step of gluconeogenesis, and propionyl CoA carboxylase for the metabolism of the odd chain fatty acids. Clear? So these are the 3 carboxylases which are biotin dependent. And guys, biotin deficiency in the babies, it is we can call it in the 2 forms. One is called as Leaner's disease. Okay, Leaner's disease. Leaner's disease is something which has been already asked as a NEET PG MCQ previously, and it is severe diarrhea plus dermatitis, right? Also called as erythroderma desquamatum, right? So that is a one. Okay, its etiology is not very much known, but it responds to the high dose of biotin. That is already well known fact. Okay, and guys, we can also call this disease in other way. We can call it multiple carboxylase deficiency, right? Multiple carboxylase deficiency, because the 3 carboxylases are involved here. Clear? So biotin is the correct answer here, right? Okay. And guys, the multiple carboxylase deficient patient presents with, most of the time they present with the metabolic acidosis, and these patients have a typical order, that is called as the Tom-Cat urine, right? Tom-Cat urine order. That is a typical order that probably you all know. And if it is the Tom-Cat urine order, then the order that is in PKU, that is called as a mousy order. That should be called as Jerry's order, isn't it? Sorry for the bad joke. Okay, so let's take the second question, number 2. Fine. So again, there was a child with history of the late wound healing, repeated infections, and the dryness around the mouth and eyes. So that was repeated infections and dryness around the mouth and the eyes. So what is the probable answer to that question? See, there were 2 options here, zinc and riboflavin. right? Whether it's mineral or vitamin, I'm not sure, but zinc and riboflavin, as per the students, they told me that these two are the option. You can tell me the options if I'm correct. Okay, so guys, late wound healing, zinc is very important, most important mineral for the purpose of wound healing. Okay, so that is here, I believe this can be the answer, zinc. Okay, and there is a dryness around the mouth and the eyes, right? Dryness around the mouth and eyes, so that may be the part of the spectrum of acrodermatitis enteropathica. And one more thing, there is repeated infection, guys. So zinc is very important for the immune cell function or the maturation of the B and T cell, right? So those who has who have my notes, they know this point already. That's very important for B and T cell maturation or immunity. And the third thing is acrodermatitis enteropathica deficiency, may also called hypogonadism. So this baby may present with hypogonadism and zinc deficiency. And acrodermatitis enteropathica, right? Acrodermatitis enteropathica. What else, guys? What else about zinc? Zinc is very, very important for the formation of the gustatory proteins, right? So it is important for the taste sensation, and that is why the deficiency of the zinc will also lead to hypogeusia, right? That is also one of the question has been asked, hypogeusia. Clear? Fine. So these are the points about the zinc that you should know, right? Riboflavin, in case of riboflavin could have been answered if the question states about stomatitis or glossitis, and there is, let's say, the darkening of the color of the tongue that becomes magenta colored. Fine. So the triad of circumcorneal neovascularization, that is new blood vessels around cornea, plus stomatitis and the glossitis, right? So these three are the common features in the riboflavin deficiency. So not this question looks like riboflavin deficiency, right? Okay, so let me know if anything I can add here or delete here. Guys, there was again a question which was a one-liner and very simple, that an infant had black colored urine, and the options were very easy, like maple syrup, alkaptonuria, etc. So the probable answer is definitely alkaptonuria. Two contradictory words I'm using, but alkaptonuria is the answer. It's a black colored urine. So what is the deficient enzyme, guys, in the this disorder? Homogentisic acid oxidase is the name of the enzyme which is most commonly deficient. And guys, this homogentisic acid, because it is present in the urine, it has a very high affinity for the alkalis, right? That's why the name was given alkaptonuria by the Garrod. It was a part of Garrod's tetrad. Fine, the Garrod who coined the term inborn errors of metabolism, right, guys? So that is alkaptonuria is the most probable answer here. Fine, if this was the question, one-liner. Okay, fine, guys. And when this deposition of homogentisic acid, it occurs in the various tissues, especially the collagenous and cartilaginous tissues, right? There is accumulation of this homogentisic acid, right? And it converts into some other compounds like benzoquinone. And guys, when the color, or I can say the color of the skin changes, when the external features of alkaptonuria appears, we call this disease as ochronosis. Okay, ochronosis. So when there are external features, they are appearing, like darkening of the sclera or the skin of the palm and the sole. When these features appear, we call it ochronosis, because the skin biopsy will show us the ochre colored dermal fibers, which may appear like the banana bodies, ochre colored banana bodies. Okay, guys, so that is question number 3. Fine. In PKU there is a mousy order, right? But the urine color is not changed. In maple syrup urine disease also, there is no change in the color of the urine, right? And the urine has a typical caramel-like, or I can say intensely sweet order, which is of burned sugar, right? So burned sugar order may be present. Am I right? Okay, moving on to our next question, that is question number 4. A child which is a case of hypoglycemia in the fasting state and normal after the meals. Okay, so case of hypoglycemia in fasting and normal after the meals. Fine. And on investigation, it was mentioned that no glycogen was present in liver. So guys, this is the biggest hint here, no glycogen present in liver. So that means the glycogen if present was undetectable, and obviously it was not being able to synthesized, and that's why the glycogen synthase was probably deficient, right? Okay, so which is a rate limiting step of glycogen synthesis, right? So this is a rate limiting step of glycogen synthesis, and if this enzyme is missing, obviously the glycogen stores will be very, very low, isn't it? Okay, and that's why the baby had, or a child had, the fasting hypoglycemia, right? As soon as the baby consumes the food, the blood sugar becomes normal, right? So the features of hypoglycemia will not be there. Fine. So most probably this was the case, that is glycogen synthase deficiency, which is it used to be called previously as glycogen storage disease type 0, right? GSD type 0 basically. Okay, so that is the answer. Now the other options were like glucose 6 phosphatase, which was a case where definitely, the case is what I can say is like, it is having the similar presentation, at least in that phase, that fasting hypoglycemia, as mentioned in the MCQ. Fasting hypoglycemia is also there in the von Gerke's disease. But guys, that is because of glucose 6 phosphatase deficiency, right? Which is the final enzyme of both gluconeogenesis and glycogenolysis. And we all know that gluconeogenesis, there are two processes only, that is gluconeogenesis and glycogenolysis, right? Both occurs in the liver, and both are having the same last step, that is glucose 6 phosphatase, and these are the only two processes which maintains the blood sugar in the fasting state. So if this enzyme is missing, definitely there will also be severe fasting hypoglycemia. But the point is that glucose 6 phosphatase deficiency always have present with the enlarged abdomen due to massive hepatomegaly because of excess accumulation of the glycogen, right? Because glycogen was not degraded at all, but it was normally synthesized. Synthase was present, na? So it was normally synthesized but not degraded. So there will be large stores of glycogen and enlargement of the liver. So this is not the answer here. Fine, guys. And branching enzyme, right? Branching enzyme deficiency is again not the case here. That is Anderson's disease, and they don't present with hypoglycemic features commonly, but only with the liver failures because of deposition of amylopectin, or we can say the insoluble glycogen. Okay, guys. Okay, so you can add here if something is missing, or if I have to add something here, you are most welcome to please comment and help me to complete the questions, right? Okay, because you are my guide, you are my torch here, right now in these MCQs. Okay, question number 5, again one of the very repeated MCQ, that is on the question was some images were given, and they asked, and one of the image was a crumpled tissue paper appearance, right? And they asked the name of the enzyme deficient. Okay, so that was a case of Gaucher's disease, and glucocerebrosidase is the name of the enzyme that we all know, right? Okay, you can tell me the other 3 options. Fine, that doesn't matter because the answer is clear cut. Fine, guys. Okay, so that is question number 5. Moving to the next question. I'll not take your much time because I know you guys are already done. You have faced a lot already, 200 MCQs. So question number 6, a child with the muscle cramps. Okay, so muscle cramps. So whenever the muscle is being involved, so I will rule out 2 options, that is von Gerke's and type 6, that is hers. So type 1 and type 6 I will rule out if the question says about muscle problems or the muscle cramps, right? For example, or the hypotonia or the muscle weakness. So if that is mentioned, rule out type 1 and type 6, which are totally hepatic, right? Okay, there are some mixed like Pompe's, but here we will rule out these 2. And guys, there was a low lactate level. I'm not sure if after exercise was mentioned or not. So there was a low lactate level. So guys, low lactate levels are present in both the cases of Taroi's disease. If it was option, let me know whether it was option or not. Okay, so I'm not sure if it was option, right? But McArdle's, most student told me McArdle's was given in the option, and so that is my answer here, right? So why there is low lactate level, guys? Lactate is simple. देखो lactate कहाँ से बनता है? Lactate बनता कैसे? Lactate is made from only glucose, right? And glucose in the muscle during exercise is given by glycogen metabolism. So if the glycogen is not degraded, how will I get the pyruvate? And if pyruvate is not made, how will I get the lactate, right? So that is why lactate levels are low in that case. Okay, especially after the exercise we can test them, and sometimes we also called it like forearm ischemic exercise test, FIET, forearm ischemic exercise test, right? So after giving the conditions of ischemia to a particular arm, and if you collect the blood sample after the exercise, then they will be lactate levels will be low, but lactate level should rise ideally in anybody, right? Okay, in a normal person, because that was anaerobic glycolysis should happen. But here the glycolysis is not happening because obviously the glycogen was not degraded to the pyruvate. Fine. Okay, glycogen first makes, always remember that in the muscles, glycogen when it is degraded. So here there is a deficiency in the type 5 disease. So I will not get glucose 6 phosphate. And if I'm not getting glucose 6 phosphate here, then I have to go to the glycolysis. And this is my type 7 disease. If it is missing, like PFK1 is missing, then there will be first pyruvate formed, and then from the pyruvate we get the lactate. So obviously in the type 5 disease, that is our case, in the type 5 we will not get the lactate. You got my point? Very simple. So Tarois and McArdles, they have similar presentation, but in the Tarois there is hemolysis also present, right? So if they mention hemolysis, then था क्या ऑप्शन में, क्वेश्चन में अगर था तो then please let me know, otherwise आंसर हो जाएगा हमारा McArdles disease. Right guys? Okay, number 7 question, very easy but a little bit twist, which was again not difficult one. Gamma glutamate dependent, okay, clotting factors. So guys, the question should be like this: gamma glutamate carboxylation, okay, gamma glutamate carboxylation dependent clotting factors. That should be the question. So guys, obviously it is vitamin K. Vitamin K activate the enzyme that is called as the gamma glutamyl carboxylase. So guys, this is the carboxylase which is not biotin dependent. Okay, biotin dependent carboxylation reactions like CPS1, CPS2 and this one, right? But this is dependent on vitamin K. Vitamin K is the only fat soluble vitamin which has a coenzyme role. No other vitamin has coenzyme role in the fat soluble group, right? So gamma glutamyl carboxylase is the name of the enzyme. And guys, factor number 2 like prothrombin 2, 7, 9 and 10, these are dependent on vitamin K. What is the test for vitamin K deficiency? Prothrombin time, right? And also there is a new test, that PIVKA, right, 2. Okay, that is a other test for vitamin K deficiency that can be done. Vitamin K toxicity is hemolysis, basically because it binds the glutathione and depletes its level. Okay, so protein induced by vitamin K absence, PIVKA2, right? So guys, that is question number 7. Fine, you can again tell me, let me know if something is missing or something that I should add here. You're most welcome. Bleeding gums, right? There was a question that patient had some bleeding gum and delayed wound healing, right? And it was given that it's a case of scurvy. So it is due to, so guys, probably this was option number 8, decreased collagen cross-linking, right? See, if cross-linking was mentioned, vitamin C is not directly related with cross-linking. This is a case of vitamin C deficiency, definitely. So there can be options like, decreased collagen synthesis, that is also correct answer. Decreased collagen cross-linking, actually cross-linking is a case of, is a job of lysyl oxidase enzyme, right? And lysyl oxidase enzyme is a copper dependent enzyme, and guys, copper deficiency is called as Menkes disease, right? So cross-linking of collagen, I'm not sure if this was the exact word that was mentioned in the MCQ. So again guys, I need your help here. But yes, it was something related with collagen that was mentioned and that most of the students have marked. So probably collagen synthesis decrease, that is correct answer, right? And even if nothing else is mentioned about collagen word, then this is the answer, right? Okay, but ideally it should not be the word collagen cross-link, because collagen cross-linking occurs by the aldol condensation reaction. This lysine is converted into aldehyde lysine, right, by the help of this copper dependent enzyme that's called as lysyl oxidase, and that is actually missing in the case of Menkes disease. Am I clear? Right? So That is question number 8. Fine, let me know more about this. Thank you in advance, right? Okay. Next question is a case of diarrhea, dermatitis, and dementia. That was straightforward question they asked, and that was a niacin deficiency. Nothing to worry about. So I think it was very scoring here, my subject, right? And for the first time, they have not asked any question on genetics. I think if there was a question, please let me know on genetics also, right? And there was less questions directly related with the cycles. So it was very much clinical scenario they have asked. Fine, but that is me, guys. Just remember this. This can be a trap for the next time, that nothing else will be asked. You just remember only few things, that is vitamins and minerals, and you are done. So that is good if it is like that, but it may be a trap. Ki, leave everything else and stay with these important topics which are only clinical. So that would be highly appreciated if they ask only this much, and that will make the life easier, right, for you guys, for me, right, also. Okay, so a case with a cherry red spot and no hepatosplenomegaly, right? So there was again a case with some history, long clinical question it was, probably, right? But they mentioned that cherry red spot is there. See guys, I always mention in my lectures also that whenever the cherry red spot word is mentioned, 99% the answer is Tay-Sachs only, right? That is very specific for the Tay-Sachs disease. Okay, but they also mentioned probably, like students are again differing here, that it was mentioned, may not be mentioned. There was no hepatosplenomegaly was mentioned clearly. So guys, when no hepatosplenomegaly was mentioned, definitely it's Tay-Sachs disease, right? That is the Tay-Sachs disease is the answer. But if they say that hepatosplenomegaly was present, fine, then the question becomes actually difficult, right? Why? Because it can be a case of the Niemann-Pick's disease. Fine, right? Also guys, cherry red spot with hepatosplenomegaly and some other features of organomegalies may also be present in a variant of Tay-Sachs, that is Sandhoff's disease. Fine. Basically, we cannot differentiate Sandhoff's and this Tay-Sachs disease, except for one point, that Sandhoff's has also the accumulation of globocytes apart from GM2. So when we say GM2 plus globocyte, that I will say Sandhoff's disease. And if it is only GM2 gangliosidosis, that is Tay-Sachs disease. But this much was not given in the MCQ. Fine. So let's stick to our point, that is Tay-Sachs disease. Okay, clear to all? Right. So in this way we can answer this question. So in the Niemann-Pick's disease, if they have mentioned anything else, like the accumulation of the material, for example, sphingomyelin, right? That is a sphingophospholipid. The only sphingolipid which has phosphate is accumulated in the lysosome. So that may be Niemann-Pick's disease, right? Okay. Moving to our last question that I was able to compile today. That was again the question that I want to know, that there were two cases. I think one was a case where the typical presentation of beriberi was mentioned, right? Pitting edema and everything, like features of CHF were mentioned there. So I'm not sure what was that question was, but then there was a question that there was a group of people who were consuming a simple food like rice, and they present with the bilateral muscle weakness and walking on the toes, something like that. Okay, so which of the following should be used in evaluation? So guys, this question, I think I have mixed up some one or two questions. Again, I need your valuable help here, right, to delineate the exact MCQ. So which of the following should be used in evaluation? So there was one question for sure in which there was a deficiency of vitamin B1 or thiamine, and they asked the name of the enzyme that is used in the evaluation or investigation. So guys, the answer is transketolase for sure, right, as you all know. So we have only few named tests for the vitamins, right? Our name test for vitamins are like the transketolase test, that is a test for thiamine deficiency. Then for riboflavin deficiency, we have a test that is called as glutathione, okay, glutathione reductase test, right? That was a test. And then for the case of vitamin B6, guys, we have erythrocyte transaminase, Okay, test. So that is a test. And also xanthuronic acid test. That is also called as tryptophan load test. Fine. So xanthuronic acid or tryptophan load test. These are the two tests for vitamin B6 that we can remember. And for folate, we have a named test that is called as FIGLU test or the histidine load test. Right? FIGLU test or the histidine load test. Am I clear, guys? So these were the few questions that I have right now. Right, so if you know something else, some other question, maybe on mucopolysaccharidosis, maybe on some lipid disorders, or maybe on genetics part, or maybe one more question on vitamins that I missed here, please let me know. Please just mention these questions in the comment section. Right, guys? Okay, so thank you so much. Right, all the beautiful people there. Okay, thank you so much, and all the very, very best for your results. Right, bye bye, see you, thank you.